Doc Talk Live. Hey.
See, I think we're live on my thing right now.
We are? Okay. Because I'm looking for questions to come through.
Got it. You were on now.
Are we on Facebook? Okay, good. All right. Well, welcome everybody that hopefully is going to join us. We are going to have a little discussion here about staying healthy and sane in the time of COVID. I've got Dr. Bradley Goodman and Dr. Peter Hogenkamp on board. Why don't you guys give a little intro, explain who you are, why you dragged you into this thing?
You go ahead, Brad.
Okay, I'm Brad Goodman, and I'm a physiatrist, physical medicine and rehabilitation. I do have a strong interest in wellness. I do my own podcast or vodcast called Doc Talk Live, and I've connected with you guys through Doc Talk Live, and I think we share a lot in common. So I hope this goes off well, so we can do other programs and people can connect with all of us in the future. Go ahead, Peter.
Thanks, Brad. So I'm Peter Hogenkamp, and I'm a family doctor from Rutland, Vermont. And I also do a lot of stuff like Brad and Jeff do. I have a show called Your Health Matters with Dr. Peter Hogenkamp, and that airs on the cable access TV in Vermont. It's also on the my YouTube channel. I also have a podcast as well. My motivation is very simple. I went into family medicine because I like the idea of an ounce of prevention is worth a pound of cure. And we're just trying to get our ideas out there about we can make our society a healthier society. And I think a lot of those things are easy and cheap to do if you know how, and if you're motivated to do so. So that's what we're trying to do here today, is motivate you to get out there and improve your health without anybody else's help but your own.
Well, and I think that we all are in agreement. And so, one of the points of doing this particular broadcast was like, all these, we're seeing all this bad news. We got all, I think people's anxiety levels are, what do you think? Maybe just slightly elevated?
Just slightly.
With, apparently there's some event going on today that, do you guys hear about that? Is there something happening today?
I wanted to get a I voted sticker, but I forgot to get it.
Yeah.
Oh, I got mine.
Yeah.
Anyway.
I got mine. I'm going to show it.
There you go.
I'm surprised I did it, but I voted.
Yeah, we did early voting like a couple of weeks ago, or a week ago rather. But anyway, a lot of anxiety, and then we're seeing these numbers going up and up and up. And so I thought we would talk about, what can we do to kind of protect ourselves, protect our families. Gina says her stress level is really high. Hey, Gina, we worked together a long time ago. Anyway, how do we kind of deal with it? And like, I think people are like literally that never had anxiety before. I've got patients who are like, I'm a wreck. I'm totally anxious. I'm afraid I'm going
to on that actually, and they said that treatment of anxiety is up about 30% over last year, which I would easily believe based on my own practice.
I would believe it too. And so, what as physicians who are kind of dealing with this kind of crisis, what advice can we give people to kind of mellow out? And it's, my belief is that it doesn't come in a pill bottle. I mean, yeah, if you take enough Xanax, you probably are not so anxious anymore because you're not conscious. But what kinds of things would you guys suggest people do to kind of deal with sort of the anxiety level? And then we'll get into kind of what we can do to kind of prevent, improve our health to prevent COVID. And then we'll take questions that are starting to come in. Hybrid. So we've got Shelly Kane says she's on her lunch break teaching, and she's in a county in North Carolina with the highest percentage positive rate in the state, and she's eating outside in the sunshine for the vitamin D. Shelly, awesome. Yeah, and vitamin D we're going to talk about because did you guys see the studies that came out about admitted patients? Like something like 80+% of those people admitted with COVID have low vitamin D. So, one of the things is get out, eat our lunch outside. The funny thing about our state in North Carolina, really about the whole United States, is that we don't produce much vitamin D from the sun from, late October, early November till about April. So supplementing with vitamin D during this time of year is important. I did my residency at Boston Medical Center. My wife got a master's in public health and a master's in social work at Boston University. And there was this professor there who was kind of one of these Einstein guys, kind of crazy hair and like hyper energy. And he did all this research on vitamin D. And he actually had students suntan on the roof of the public health building in Boston for the whole year. So they were out in the freezing cold suntanning. Wow. And they determined that they didn't really make much vitamin D in the wintertime because of the angle of the sun. So one thing, we know that vitamin D in COVID, and we also know that vitamin D has a lot of other really beneficial effects in terms of the heart, brain.
Jeff, in Vermont, the angle of the sun is never very good because we're on the top of the world. So what I would say, I tell all my patients, 1 vitamin D all year and 2 from November to March. And that's just basically a standard approach we use in our practice.
I am so non-compliant. I'm actually going to see my primary next week for my routine physical, and I know he's going to tell me I need to take vitamin D, and the bottle is still sitting in my drawer. I even have a reminder on my phone to take my vitamin D every 2 weeks, and I don't take it.
Vitamin D deficiency is so common here, I don't even bother checking it anymore. I just assume everybody is vitamin D deficient and treat everybody with 1 vitamin D all year and then 2 this time of year.
Wow.
Darlene Press is asking us the difference between vitamin D and vitamin D3. So, D3 I think is more bioavailable, and I think that of the preparations, D3 is probably the better one to take. And a lot of times there's a combination of the two, but I think most of those, I usually have one on my desk. I just finished.
Right, yeah. You don't want to buy anything but vitamin D3.
Yeah, the majority of them are vitamin D3.
When we talk about the sun being important for vitamin D, the sun doesn't create vitamin D. What it does do is it takes the vitamin D that we have nutritionally and it changes it into vitamin D3, which is the active form. So don't buy anything but vitamin D3.
So yes, what do y'all know about taking vitamin D with K? So, vitamin K, I guess if you don't have a clotting, if you're not on Coumadin or something like that, vitamin K, we use vitamin K2 for our patients that have high calcium scores because we think that K2 drives calcium maybe back into the bones and you can actually lower coronary calcium scores with K2. I've got a couple of cardiologists that we work with that kind of push that. What do you guys think about taking vitamin K on a sort of routine basis? Yeah,
I have no comment. I would just say I don't take anything, period, nothing orally routine. The only thing I take is a B12 shot once a month.
Because you have
anemia. And I definitely had anemia.
Yeah.
And it was corrected by taking a B12 shot. But again, I guess that's a great question for you guys. How do I get compliant with taking my vitamins? And is it just vitamin D I need to take?
I would argue that the vitamin D3 is probably the most important. Yeah. Let me put a quick plug in for diet here because I'm a huge advocate of getting your vitamins the real way, which is through real fruit, real vegetables, real meats, that kind of thing. I call it the Burger King phenomenon, and that is asking me about vitamins and stuff like that. And he says, well, I got to take vitamins because I eat a Burger King a lot. A multivitamin and 2 Big Macs and a cheeseburger is not a great way to get you want to eat good food, a lot of real food, a lot of whole foods, meats, vegetables, fruit, that kind of thing. I get a little queasy when people talk too much about supplementation because, you're taking away the focus from what you're supposed to be focused on, which is what your diet is.
And I agree. With our patients, people are always sometimes we get people come in and they're taking 20 handfuls of pills. And, so honestly, some of it's just me. I hate taking pills. So I want to take the minimal things. And so, I'm with you. I think the best vitamin is good food, good natural food. What supplements, do I generally tell my patients to take? And I've added a couple little things with COVID, but I generally tell people to take a good quality fish oil, vitamin D, and good nutrition is pretty much. I don't think.
And what makes something a good quality fish oil? Because that's a challenge right there.
Well, honestly, not to plug a particular product, but we've looked a lot, and we've used Douglas Labs for a long, long time. And I like Douglas Labs because they run themselves like a pharmaceutical company. They let the government come in and look at their facilities. But the important thing that they do is they send every one of their products to an independent lab to be tested. So you can pull the lot number up and see what they've got. And they've got a product called Quell fish oil, which honest to God is it's EPA and DHA. That's it. They use a supercritical CO2 process, so there's no impurities there. There's a little teeny bit of vitamin D. And if you look at the label, it's like 600 milligrams of EPA, I think 400 milligrams of DHA, and like 1,000 units of vitamin D in it, and that's it. The only other ingredients are the gelatin capsule. It doesn't smell, it doesn't give you fish burps, and it's very highly bioavailable. It's 1 pill a day, and like I said, I don't like to take a lot of pills. If you look at most fish oils, you got to take 6 a day, and you don't know where it's coming from. Like, you don't know, is there mercury in there? Is there lead? Who knows? So I don't like to really talk about products, but that's what we use in that particular reason, because it's very, very pure and it's easy to take. And then, it may, we do use supplements if weight loss is a concern, if DHEA levels like hormonally are not right, we'll supplement for specific reasons. Like I mentioned, people that have positive coronary calcium scores, that we know they've got plaque. Vitamin K2 has been shown to kind of reduce that plaque.
But in terms of infection,
yeah.
I always tell folks that as a family doctor, I have pretty high risk for infection. And I have been very fortunate that I haven't had a cold even in the last 5 years. And I'll tell you why that is. Because I do all the things that we're supposed to do. And that is, I just recently started wearing a mask this year. But in my practice, I've always washed my hands before and every patient. I always keep my hands away from my face. People have a tendency to, they kind of rub their nose, they rub their eyes, they put their hands in their mouth. Don't do those things. Because every doctor will tell you that when you touch stuff with respiratory droplets on it, you're getting viral load on there, and then you're bringing them to your face. We
only do that like several thousand times a day. Touch our face.
Right. It's better to kiss. It's better to kiss your wife than hold her hand.
I'll tell you said that, Brad.
It's true, though. It's true.
I agree. So don't forget about hand washing. Don't keep your hands away from your face. Yeah. I used to have this habit of always kind of putting my hand here on my face, as I thought, and I've gotten rid of that and I really think that alone has really helped me get rid of colds and viruses over the last 5 years. The basic stuff works. I wanted to ask you guys what you guys thought about HEPA filters.
Yeah, so filters, interesting, question. Like, can they help? I mean, I think it depends on like the situation. Like if you have a giant, huge open room, is a HEPA filter going to do much there? Like a freestanding one, maybe not. Smaller space, possibly. If you have HEPA filters in your HVAC system, that's probably the most effective way. We actually have a system in our house that it's actually got a UV light system. It's built in, and so it goes through the whole house circulation. It goes through this UV light as well. But I don't know. What are your thoughts?
Well, I actually saw a video this morning from Mayo Clinic about one of their infectious disease guys there, and he was saying that a HEPA filter is a good part of a layered approach to beat the virus. Don't just put a HEPA filter in and then forget about all the other measures that we know work. But when used with masks and hand washing and social distancing and keeping our hands away from our face, HEPA filters and the UV light that's often associated with the HEPA filters absolutely help. And just so that we're clear, the viral particles are too small to be caught in the HEPA filter. However, these viral particles don't go by themselves. They piggyback on either dust particles or respiratory droplets.
Which are big.
Those things get caught in the filter. So there's no doubt that HEPA filters can be part of a layered approach for defeating the virus.
Dean Barbie says that he wants someone to tell his wife that kissing is better than holding hands. Allison wants to know about if you have a fish or seafood allergy, taking fish oil, which is a great question. Now, I would say like a product like Quell, it's only EPA and DHA, you probably won't have an allergy to, because those are essential nutrients, EPA and DHA, so the fish allergy is not to those omega fatty acids. It's probably to something else. So that might be okay, but I talked to your doctor about that.
So Jeff, in those circumstances, people ask me about that all the time. So I skip over and I give them flaxseed oil instead.
Interesting.
A lot of the same omega-3 fatty acids, and it comes from a plant as opposed to fish.
That's a great suggestion. Other thing, in terms of supplements for like to kind of, boost your immune system for COVID, we know that zinc intracellularly, it acts as an antiviral. The problem with zinc is that, it's charged and it doesn't really want to cross the cell membrane. So you've got to take it with something that will transport it. And quercetin is one of those things that acts as an ionophore and actually carries zinc into the cells. So I've made a recommendation to our patients to take zinc and quercetin. And if people are interested, I actually did a handout that we emailed to people that's got the supplement recommendations to kind of prevent COVID. It's like vitamin D. Vitamin C is another one that probably this time of year with the virus going on is probably not a horrible choice. But vitamin D, there's been a number of studies that have shown it, lowers your risk of getting viral infections anyway. There was an interesting, I can't remember, it was H1n1. There was a case report of a nursing home in the Midwest someplace that had an H1n1 outbreak. And the CDC investigated because they had this outbreak and something like 21 staff members came down with H1n1 and one resident. And you really would expect the opposite. Mm-hmm. It's an old age home, a lot of vulnerable people. And they went in there and what they found was all the residents had very high levels of vitamin D because the place was run by this old country doctor and he gave everybody high dose vitamin D. And all the staff had low vitamin D, and the one resident that got it had just transferred in there and had a low vitamin D. And all the other residents in this nursing home had high vitamin Ds, and none of them came down with H1n1. Yeah. And so that's interesting. And I was just going to kind of use that as an example for why you might want to take vitamin D. Let me look at some of the comments here. Peter, I don't know, are you guys seeing the comments come up on yours or my?
I can't see because I'm on my phone. I have a question for you, Jeff. In your wellness practice, because you really do a very comprehensive evaluation, do you do remote? Do people contact you and see you remotely?
Oh yeah, we have patients actually all over the world. We have patients in South Africa. We have patients in Portugal. We have patients in England, and all over the country.
So you have the capability of evaluating people remotely.
Yeah, because we can get lab work done almost anywhere. It's as we've all learned, right? Like we're in 3 different states. We're having a nice conversation, and we've got almost 100 people have joined us here. So
I would love to put one of your evaluations, if you could blank out the name, on Doc Talk Live, because I have a feeling, my hunch is that when people see you and get a incredibly comprehensive type of evaluation, they get a handout, a readout, a printout, a clinic visit, a note that really then shows them exactly where they need to focus their efforts, whether it's on taking vitamin D, in my case, or a better diet because they're overweight, or exercise because they're just not physically active enough.
Yeah.
I imagine that is something that really is very useful in terms of getting folks to make lifestyle changes.
And I don't want to make this about my clinic and what we do here, but what we try to do is give people certainty, clarity, and direction. So we get certainty by doing a pretty advanced evaluation, looking at advanced lab work, coronary artery calcium scores, genetics, family history, lifestyle factors, body composition, lots and lots of brain function. Clarity is like you sit down with me for a couple hours and we go through all of it and see what it means. And direction is like, okay, these are the things that we need to work on, and this is how we're going to do it. So we do these pretty advanced evaluations, and it's very helpful because we can predict things like diabetes and heart disease and stroke and Alzheimer's a decade before it actually happens. Let's see. Gina Mitchell agrees that we should get our vitamins from nutrients. Always exhausted. Lupus.
Did you see the question about elderberry syrup?
Huh?
There's a question here about elderberry syrup, and I get a kick out of that because at least 50% of the of my staff, they swear by elderberry syrup.
Yeah, and I think there have been no real good studies, but there's some anecdotal thing. It's bactericidal, I think, in culture media. I actually have a former nurse I used to work with. I ran into Harris Teeter not too long ago, and she actually makes like homemade elderberry syrup.
Oh yeah. One of the girls in my office makes it and gives it out, kind of thing, and they all swear by it. And whenever they ask me about it, I always come back with my standard approach, and that is, I don't mind you doing stuff like that, but I don't want you to forget about the pillars of staying uninfected, which is keeping your body and mind in the best possible condition. Yeah. You want to exercise, you want to sleep well, you want not to drink excessively, you want to not smoke. I'm a huge believer in, whole foods as part of a kind of nutritional answer to staying well. And I also think there is a tremendous amount about your mind and keeping your mind healthy. Because once you do that, I really believe in the mind-body link and the ability of your mind to kind of keep your body going. So don't neglect your mind. And I tell people, so engage your mind, read. And if you're interested in a book, so engage your mind by reading, doing crossword puzzles, interacting with other people. In my opinion, the worst thing that you can do for your mind is just to sit around and watch TV all the time.
Yeah. So just to plug Peter, if anybody doesn't know, Peter just is an author, physician, friend of mine. We went to medical school together, but you just published your what?
My second book called The Vatican Conspiracy, which is available on Amazon.
What's it about?
What's that?
What's it about?
So very briefly, I have always wanted to write a thriller, but in the process over the last 10 years of writing and getting rejected with a lot of my ideas, I finally came up with the idea that writing the classic thriller wasn't going to get published, that I had to come up with something new. So I came up with the idea of a priest being involved in a plot he's trying to prevent the Pope from being assassinated. And the nice part about it is nobody expects a priest in the role of James Bond. And the kind of internal conflict and all the the kind of oxymorons that you would expect of a priest having to kill other people. A priest, he gets involved in romantic situations, all that kind of thing. But the internal conflict is fantastic. And I appreciate the plug. The book is called The Vatican Conspiracy. And if you're interested, go to it on Amazon.
Awesome. Jamie Dick said, mentioned EGCG as a better zinc ionophore. It is. I agree. It's just not. The problem is it's difficult to find, and so I generally have recommended quercetin because it's a little bit more easy to find, and also the dosage can be a little tricky. So I try to make things as simple. I'm an ER doctor. It's got to be stupidly simple for me. I'm sorry, we just are not very bright. We just want
to hear about the flu shot. And someone mentioned here that the flu shot is more important than ever this year, and that is absolutely the case.
Oh yeah, definitely.
Obviously, we have flu shots every year, but this year, because of the comorbid COVID epidemic, we've got to keep the amount of flu down so that we don't overwhelm our healthcare system. So if you're one of these people that hasn't gotten a flu shot, please go out and get yourself a flu shot. I've noticed in my office, we're getting people that have never had a flu shot before come in. So we're seeing quite a big increase in the number of flu shots that we've administered. So we're real pleased about that.
There's a case report, I think, that came out yesterday, the first documented flu plus COVID case.
Really?
So that would really stink. We are actually doing, starting this week, I think, we're doing a multi-test for admitted patients. It's RSV, flu, and COVID all together for those patients who are getting admitted. And then, there are other ones that like BioFire. I don't know if you guys that's like a hospital thing, but BioFire is a respiratory virus panel that looks at like maybe 30 different common respiratory viruses. So if you're doing like a septic workup on somebody, you're trying to figure out what the source is. But I do think flu, I've gotten into these weird conversations over the last couple of days with a couple of people that I really know and respect who have kind of like said, oh, these cases are overblown. And, once the election happens, it's all going to go away. And these are like intelligent people. And I'm like, I'm in the hospital and the hospital's full. And the other thing I've gotten from a number of people is like, oh, the flu's disappeared. Well, first of all, the flu season, at least in North Carolina, hasn't even been declared yet.
Right. Yeah.
Generally, it's early to mid-November that there's enough cases out there that the flu season is declared. Remember, the flu season typically is, November to April, and then it goes away. So, yeah, you haven't seen any flu in the summer because we never see flu in the summer. But also, those same precautions that we use to prevent COVID will also prevent other respiratory viruses like the flu. So hand washing, masks, social distancing. So I anticipate we'll see a very mild flu season this year because of the things we're doing to prevent COVID. But that being said, I can vividly remember years ago working and walking into this room, and there was this guy. They were building skyscrapers down in Charlotte, and he's one of these high steel workers. And he was so big that he didn't fit on the stretcher. He's like, his legs were hanging up. He was like 6'8", giant, manly man. And he was on the stretcher in a fetal position, shaking and crying because he was in so much pain from the flu. And I'm always like, I'm going to get my flu shot because I don't want to be that guy, because I'll bet you he doesn't do that very often. And, if you get the flu, like, you're sick. Like, that's 5 to 10 days of absolute misery. And I don't want it. Like, I've seen plenty of people, and people think, well, I got the flu shot and I get sick. I'm like, no, you got the flu shot and then you caught some other virus. Right. If you got the flu, you'd know it. Flu feels like someone hit you with a baseball bat, and, you're really, really.
I always tell people, the people that aren't afraid of the flu have never had it.
Yeah.
Because I have actually had the flu. And even though, a healthy adult, I was flat on my back for a week, sick as a dog. I can diagnose the flu with one look. I look at the person, and if they look
miserable, are they?
Die, like, please kill me to end the suffering. That's the flu.
That's the flu. Yeah. And I was explaining that one of the reasons that we want a flu season declared, because like in the emergency department, once flu season's declared, if you come in with fever, body aches, and look like crap, that it's the flu, and like, I don't need to test you. If you say, hey, you got the flu, these are the things that you can do. People think, well, I need Tamiflu. Like, okay, so right now you got fever, body aches, you're fatigued, your throat hurts. So let's add Tamiflu so you can add vomiting, nausea, and diarrhea to your suffering to shorten the course of it by a day. So
I've had good success personally taking Tamiflu. So I don't know if I've just knocked out other viral illnesses or not, but I like to have Tamiflu on hand. I don't want to wait to try to find Tamiflu if I'm feeling.
But it doesn't.
Bluish.
All it does is shorten the course by a day. Now
if you catch it early,
extremes of age, it's indicated it can be life-saving for those less than 2 and older than 65.
But in my practice, we use Tamiflu all the time, very successfully, in the setting of prophylaxis of family members.
Yes, well, that's right. If you're exposed and you haven't got symptoms yet, yes.
It's amazing to me how well Tamiflu works in the setting of household contacts of not getting the flu when their mom or sister or brother does.
It doesn't do much if you got it.
I have found that it's very minimally effective, but I love it for prophylaxis.
Yeah, and I do, when in the emergency room, we oftentimes write for the family members, and you're right, if you can avoid it, right? So let's look at it. So James Dixie wants to, can quercetin be harmful in long-term use? I think high-dose long-term use, even zinc, shouldn't be used for extended periods of time. I do think in moderate doses, in the time of COVID, it's probably a good idea. Even if you took it, every other day, like maybe not take it every day. And then he also asked about front runners for COVID vaccines and phase 3 trials. That's a great question. There's how many? I think there are more than 9 vaccines in phase 3 right now. people keep saying, "Oh, there's going to be a vaccine in November." Well, would any of you guys take a vaccine that came out in November?
Well, I would if the data on it, if I was able to review the data on it,
right?
I would absolutely do that. I wouldn't do it based on any politician telling me to take the COVID vaccine. However,
I think there's no way to get a good safety data in November.
Yeah.
Think about the first one, the Moderna one. I think they started doing trials on August 1st, and it's that vaccine is 2 doses a month apart. So, so the second dose would have been given September 1st. So,
we're going to see data probably certainly before the end of this year.
Yeah, I mean, I think that I would like to see at least 6 months worth of safety data before I jumped on a vaccine, unless unless the research was just stellar, and
or if we're seeing, right now we got 100,000 new cases a day. We haven't hit Thanksgiving yet, but we're just getting into cold and flu season. If those numbers absolutely escalate like they may, we might be in a situation where, if the vaccine data is good and the safety data is good, the slight risk of a vaccine would then have to be compared against the huge risk of no vaccine. We're getting 1,000 deaths a day right now, Jeff.
Yeah, that's a great point. And before we started the broadcast, Peter and I were talking about, when you see 100,000 cases in a day,
100,000.
What I think of is like, okay, that translates to some percentage of those people getting admitted to the hospital, not today, but a week to 10 days from now, because that's when they're going to get sick enough to get in the hospital. And then that's going to translate into a percentage of those dying 6 to 8 weeks later, because like those COVID deaths happen months after people are admitted. They linger on the vent for a month or more.
Right.
And so that's when I look at those numbers, it gets me so scared. And especially here where we had 38 patients boarded in the ED a couple weeks ago, because there's no capacity in the hospital and no place to transfer them. And that's at a time of year when, hospital admissions are supposed to be low in the early fall.
Historically low, correct.
And what does that look like in January when the hospital is normally full, and you add in 60 or 100 COVID patients? Where do you put them? And these people require, and they don't, the other problem is that you're not, you come in with pneumonia, how many days you think you're admitted for? A day, 2 days?
Yeah, I bet the average length of diagnosis is 2.3 days for pneumonia.
Yeah. So COVID, those people are in the hospital for, a week sometimes or more.
Jeff, getting back to the vaccine issue, my patients ask me this all the time. And they ask me, how do you see this sugaring off as time goes by? And my answer is pretty simple. I think it's going to go out to the high-risk people first. And those people who, because their risk of dying from COVID is far greater than you and I.
Yes.
And so those people, if the vaccine has some safety issues that may not have been perfectly worked out, those people still have such a great risk of getting sick from COVID that the answer for them is going to try the vaccine, even if there's only 3 months of safety data there.
It's sort of a risk-benefit ratio, and you got to say, where am I at bigger risk for?
If I'm a 75-year-old hypertensive, with bad lung disease, and I've got diabetes, I'm thinking I'm going to say, I'll take a slight risk of this vaccine. A young, healthy person, probably not a great idea.
Yeah, and I think that let's just for the sake of argument say that we have a effective, safe vaccine available February 1st. It's been kind of vetted and everything else.
Right.
Well, how do we get it to the billions of people that need it? How long is that going to take? And there was a movie, was it Contagion or there was a movie that was very prescient in terms of a very similar situation with a global pandemic. And I remember they eventually find a vaccine, but it takes about a year to get it to everybody. And they actually have a lottery system, and every day they would pull out somebody's a birth date out of the thing, and the people who were born on that day could get the vaccine, and then you get an armband and said, hey, I'm okay, and you could go back out into society. And it's so the fact that the vaccine is available, it still needs to be produced, it needs to be distributed, it needs to some way of people paying for it and everything else. How is government going to do that? Is insurance companies going to do that? We don't know. So it's a complicated problem. And so I think we don't have good answers. So in the meantime, we got to like do the things we know work.
Absolutely.
And if you get the vaccine, does it confer
soap, water, masks, space?
If you get the vaccine, does it confer any functional benefit? I mean, can you go to a sporting event? Can you go to a crowded bar? I mean, that to me would speak volumes in terms of why somebody would get vaccinated, in terms of their ability to participate in the activities they want to do. Fortunately, I like to play tennis, and it's an outdoor sport, so it's not a crowded indoor sport. But if I enjoyed basketball on a floor with 10 or 15 people, that's a different story.
Totally different story.
Yeah. Well, I went to work out yesterday. I work out at a CrossFit gym, and from the beginning, I kind of told the owners that they've got a really good situation. They've got a building that's like a massive sort of warehouse-like structure. It's got probably 30-foot tall ceilings. It's got garage doors all around the periphery. They got these big fans. And I said to the owner, listen, as long as you keep those doors open and you keep those fans going, it's essentially like being outside. And if you limit the class size, you're going to have very, very low risk of anybody transmitting things. But, I went in there and it was colder, and suddenly the doors are closed and the fans are off, and there are like 50, 60 people in there. Well, all of a sudden you went from a very safe situation to a very dangerous situation. So where you before, with the air circulating around, somebody who's got COVID could maybe, probably isn't going to be able to expose anybody because of the circulation of air and everything else. Now you shut everything down. Now you got one person in there, and they might expose 20 or 30 people. And you suddenly go from a fairly safe activity to a super spreader event, by just not sort of paying attention to sort of the physics. And, that airflow is incredibly important. There's a question here from T.N. Rhodes here that is talking about her brother who tested positive 10 days ago, was hospitalized 9 days ago, and just got placed on the ventilator this morning. And she, wants to know, statistically speaking, would you mind sharing how someone like that might go? And he's got some pulmonary damage from bronchitis, diabetes, overweight, high risk. And so, I don't want to, give, be a downer here, but we know the mortality rate for folks that are on the vent is quite high.
It is high.
And that is in part because we do everything we can to keep people off the vent, because the mechanical ventilation actually causes more damage. It causes more inflammation. I'm assuming if he's been in the hospital for 9 days, he's probably got
everything else,
IV steroids, all the things that we've tried. And so, and I would love to say that it's a low percentage. I think it's high. He's at high risk. And if you put his name in there or his initials, I will add him to my prayer list, because I think he's going to need all the support we can all give him. And that's being said, it's not a death sentence by any means. He's at very, very high risk. Right. And unfortunately, once you get put on the vent, especially if you have underlying problems, you can be on that vent for an extended period of time. I had a patient just recently whose father was on the vent for over a month related to COVID. And again, Ann, I'm very sorry about your brother, and we'll keep him in our prayers.
Absolutely.
James again asked about, do you guys frequent restaurants during this time? Indoor restaurants are packed. Most require masks to walk in, but then you sit down and take it off. It's a good point. I mean, I went down for dinner with some friends in South Charlotte a couple of weeks ago, and I was like shocked. I mean, that place was packed. I mean, absolutely packed. And we ate at a restaurant that has like an inside courtyard, and it was fairly well spread apart. But some of the restaurants we walked by, people are shoulder to shoulder. There's an outdoor brewery down there, and they make you wear a mask to go up and get a beer. But then they have these picnic tables where there's like 15, 20 people on top of each other at the picnic table with no mask on. And
if I could interrupt there, I advise people about this all the time, because I think that going out and doing these things is an important part of our lives. It's an important part of our sanity. And it's an important part of our wellness, to go out and interact with other human beings. It really is important. However, I think you got to be smart about it. My wife and I love to go out to dinner. We've been going out to dinner all summer long outdoors. And we even went, last week out to dinner. We were the only people sitting out at a patio, 50 degrees, but we had one of those heaters. And it was great fun. I thought it was fantastic. I don't think we'll be going too much to eat indoors over the winter, especially in those shoulder-to-shoulder situations. They seem to, and trust me, I will miss that. I'd love to go out to eat. I'd love to go to bars and see friends, have a couple drinks. And I'm not doing those things. I just don't think the risks-benefit ratio kind of pans out for it. I do think those things are healthy and an important part of our wellness. Like Brad, I love to do outdoor activities. I'm a skier and a hiker and a golfer, all great activities. I say everybody develop more outdoor interests.
Yeah, I think it's a good point. I think at restaurants, you've got to kind of play it by ear. Like, we're in the South, we can sort of eat outside a little bit longer than you can in Vermont. And I think that's, but again, I think you got to be smart about it. And, I've done videos about COVID fatigue. People are just sick of it. They just want it to end.
Right.
Unfortunately, it's still here. So as much as I really, 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 really want it to end, that doesn't make it end.
I think you have to sort of look at risks again too, because if you're overweight, diabetic, I think you have to be even more cautious than if you've done things to be in a healthier category.
Brad, I love that point. And I use this kind of like, I always tell people, like, there's this whole, I call it the shark phenomenon. It's like when I tell patients the bad part about something that they might be doing, like drinkers, they might end up with liver disease. I tell people, listen, if you're diabetic, if you're overweight, now is the time to take care of yourself, totally revolutionize your health and maximize your health so that you don't, if you do get COVID, you don't put yourself at risk of being on a ventilator or going to the hospital.
Absolutely.
So I see this as a positive opportunity.
Yeah. Hey, you guys, just for the people who are watching, if you were listening, Ann Rhodes was telling us about her brother. His name is James Howard Rhodes. If you happen to be someone that is believes in prayer, put him in your prayers. I'm going to put him in mine. Jenna is asking about some people at work are concerned that they'll be required to get a vaccine or lose their jobs. Healthcare, thoughts on other businesses and places. I would think it would be very difficult for a business to mandate a vaccination. A hospital certainly can, and we are mandated. Like we have to get a flu vaccine. It used to be if you didn't get the flu vaccine, you had to wear a mask. Now they haven't changed the flu vaccination, but and I fully so for example, I got my flu shot, but I forgot to email it into whatever office at the hospital, and I got a little nastygram that said you're going to lose your medical privileges if we don't get it by the 31st. So for physicians, like I can't keep my medical privileges at the hospital if I don't get a flu shot.
I also think we're required to get a COVID test ultimately, a COVID vaccine ultimately before they go to school. Just like they need to have a mumps, a mumps titer and a polio test, or it's going to be vaccine. I think that'll ultimately be required for school kids as well. I can't wait until it is required, because when we know that there's a safe, effective vaccine, that's going to be a better day and age than we're living in right now.
So Susan Wolfong asked, someone mentioned there's a tennis player playing outdoors is low risk. What do we think about playing indoors during the winter months? Is it considered high risk? Well, I would think it's still low risk, because like indoor tennis facilities are big, and again, like we talked about with the gym earlier, like if you got a lot of volume, a lot of air volume that can move around, remember, infection is about exposure plus time. So what's risky? Enclosed space, close proximity, lots of yelling or singing or things like that. So bars, churches, social gatherings, concerts, those are high risk things, because you're in close proximity and you've got a time to be have an extended exposure. If you're playing tennis, like you're not going to probably catch it from the ball, honestly. And you're far apart. You're going to be in a big space with lots of air circulation in an indoor tennis facility. I would still consider indoor tennis to be pretty low risk. What do you guys think?
I'm smiling because the USTA canceled all their tournaments over the summer, and then so I went ahead and played these tournaments called UTR tournaments, and they were really quite good. But it was incredibly hot out. It's 100 degrees, but they wouldn't put water on the court. So we're not going to catch COVID, but now we are going to die of dehydration and overheating. Because they didn't want and they wouldn't put chairs on the court. So you had to bring your own chairs. Some of the things that happened over the summer were just not well thought through.
There's a lot of funny things. Like we it was my birthday last week, and my family took me up to the mountains, and it's funny because all of our friends are their kids don't want anything to do with them. I can't get rid of my kids. Anything we do, they want to be involved. So we all went up with all the dogs and everything, and we rented this house in the mountains, and we wanted to go Friday, Saturday, and Sunday because we don't see patients on Monday. So Monday's like kind of a work day. So we were going to take an extra day, and they would only rent us the place on Saturday and Sunday because somebody was there on Thursday, and their policy was to to have it vacant for a day. And I'm like, and I was like, I wrote him a thing back. I said, listen, it's an interesting policy. As long as you clean the house, it's fine. I do have a little bit of knowledge about this, and we're willing to bend the rules if you are, and they wouldn't do it. So we ended up having to stay with my daughter up at App. But there's some funny things that are based in nothing, right?
Right. Based
so
in fear.
I wouldn't give up tennis and take up, wrestling. There are certain things that are high risk. I don't think tennis is one of those.
I will say this: I do play tennis with a good friend, and his mom is quadriplegic on a ventilator, and he takes care of her. And so we play outside, but he won't touch the balls. He won't touch the tennis balls.
That's
and it's reasonable considering what he's trying to protect.
Right.
But I'm touching the balls and playing with other folks. So, I'm not taking care of a high-risk individual.
Yeah. Susan asks, what are the chances of a high-risk patient getting reinfected with COVID? And I think, reinfection is a really interesting question because, if you look at, let me pull the numbers up for the day. I haven't looked what the numbers are today. So worldwide, looks like almost 47. We're over 47 million cases worldwide, almost 9.4 million cases in the U.S., 104,000 new cases yesterday. So how many cases of reinfection have we seen? Well, a handful, less than 100 worldwide. So, 47 million cases. I think that tells us that immunity at least is going to last 6 months, or more. So I think your risk of getting reinfected is low. If we look at the other coronaviruses that have been pathologic, SARS and MERS, I believe SARS, people retained immunity for 2.5 years, MERS for 1.5 years. And, it may not just be antibodies. So there's some studies that show antibodies levels drop, but, we've got cellular immunity, meaning that you don't necessarily have to have circulating antibodies against something. You just have cells that recognize when that virus is there, and they pump out the antibodies as needed. So I'm fairly confident that we're going to find that people, if they've had it, are going to probably be immune for, I'm hoping, over a year.
Absolutely. You're looking at a handful of cases of known reinfection. 47 million cases around the world, a handful of ones that are we know are reinfection. I'll take those odds any day.
Yeah. Just think of it, if it was 1%, it'd be 500,000, repeat cases. So we're talking, a 10,000th of a percent. And so I think that the risk of, if you've had it already, even if you're high risk, I don't think you have any higher risk of getting it.
I have to go, but I want to make one final comment. And that is, first of all, thank you for doing this. This has been wonderful to see both of you. I look forward to doing this again with you guys at some point in time.
Yeah, this is great. Thank you guys both.
Yes, thank you. I loved it. That is great.
But the comment I make to people is all the time, and it's this. Listen, yes, as a young, healthy person, I'm not young. I'm probably not healthy, but I like to consider myself young and healthy. I realized if I got COVID, I would be fine. Well, the reason I do all the things that I do is not for me. It's to prevent Mrs. Jones, who's 96 years old and going to die if she gets COVID. It's to prevent her from getting the disease. We're doing this as to be kind of good citizens for the other people. Because if I spread it around, even though I might not get sick, I could actually cause some people to be hospitalized, ventilated, even for them to die. So just keep in mind that it's not just you we're talking about. We're also talking about the greater good of society.
Right. And I think, a great example is that wedding in Maine, that ended up with hundreds of cases and last I heard 7 deaths. And I don't believe any of the deaths were at the wedding.
All 7 deaths were people that weren't at that wedding.
Yeah.
So those people pay the consequences for some other people going to the wedding. And I don't want to villainize them because that must have been a terrible decision to have to, whether or not you should go to this wedding. But it's just keep it in mind. We're out here for everybody else, not just ourselves.
Yeah. Katie actually had a good question. Just before, I know you got to go, Peter, but what do we know about the vaccine for children? Is it being tested in children? We don't.
Absolutely.
Yeah, it is being tested. We just don't have any specific details about it.
Right. It's being tested in children. They're being very good about testing it across all age groups, across all, both genders, across all races as well. Because we know, in fact, one of the vaccine trials was held up because the overseers didn't feel like they had recruited enough minorities into the vaccine trials. So they held it up until they fixed that. So I think the work that's being done on these vaccines is excellent. We just need a little time.
Yeah, we need a little bit of time. Well, listen, thank you guys so much for joining me today. We'll have to do this again. To all the viewers, thank you for watching this. Hope you guys got some value out of it. Everybody, please stay safe. As I always say, look after yourselves, look after your family, look out for those around you, wear a mask, wash your hands, and stay safe.
Thanks for organizing this.
And Peter,
Great to see you guys.
Bye-bye. Yes, and buy my book. Don't forget that.
And I need your help writing my book. All right, I'll see you.